A cesarean birth is exactly like a sports injury. You need to do rehabilitation on it to get the outcome of no pain and strength and returning to pain-free exercise. So sometimes it is very helpful to learn about what the surgery actually entails, which is a sports injury, right? Learn about what that sports injury actually is before we talk about the rehabilitation, because then it makes a lot more sense. So I'm going to describe to you what that C-section or cesarean birth surgery looks like. This marker is going to be the surgeon's scalpel. There are going to be 3 incisions made on your body for that cesarean birth. And 3 incisions is actually just very generalized, but it's going to look something like this. So the general or the more common cesarean birth is going to have an external horizontal incision. That goes through the skin and the fat layer and the fascia. That's going to be pulled apart. And then there's a second incision made right down the linea alba, which is also where your diastasis recti happens to be. Now, the purpose of the linea alba is to separate your left from the right side of your six-pack or your rectus abdominis. So that's going to be resected. A couple of things are going to be moved around in there, and then a third incision is going to be made right through the entire thickness of your uterine wall. Your baby is birthed, and then the uterus is stitched. The linea alba is typically not stitched. That's just kind of left to heal on its own, and it's got a pretty good outcome. And then the external incision is stitched or stapled, glued, and or covered. Maybe it's steri-stripped as well. So that is what the cesarean birth surgery entails. All those incisions I just showed you, your body is going to be able to close entirely on its own, literally in just 4 days. That's how long it takes for that scar tissue to form to ensure that both sides of the incisions are union or actually shut.